So we'll be discussing tubal ligation, which is a permanent contraceptive method or birth control method for women. Hello there, welcome back to my YouTube channel. My name is Chineye Obi. So, as a conclusion of our birth control methods, we're discussing tubal ligation today. Tubal ligation is actually a permanent form of contraception which is available for women, and usually it's a major surgery because it is done via the abdomen. Yes, there'll be tearing of the abdomen to be able to do this. So tubal ligation actually is not so common around us here, but happens, and usually women tend to take this option, especially after a surgical section, maybe a cesarean section. This procedure is actually done, but it is rare to see a woman just go in for just the tubal ligation. Usually it is probably after an operation, then they go for it. That is in our culture. So yes, tubal ligation is actually, it comes down with the complications that it actually commensurate with other surgical procedures. And for tubal ligation, it depends on the kind of tubal ligation, or the kind of what's it called, thing that was used, either the suture or whatever that was used, clip, depending on the kind that was done. Some are actually reversible while some are not, so it all depends on what was used for each woman. Then at the same time, some things that might actually be a hindrance to it is if it was done early, too early for women before their age 30. Yes, I guess hormones might actually make that ligation area to maybe get weakened over time. And also, tubal ligation tends to prevent or reduce the risk of ovarian cancer. And yes, ovarian cancer, because that part is actually either clipped or cut off. Then, but tubal ligation does not prevent PID, does not prevent sexually transmitted infection. Also, it just ensures that you don't get pregnant via the normal route, the spontaneous route of pregnancy. But if for any reason the woman later in life wants to still get pregnant, then it is done either through reversible method, and the success rate of the reversible method is actually slim. It's about 39 to 69%, which is slim. But also, like I said earlier, depends on the method of ligation that was carried out. Then aside that woman might have to go through the in vitro fertilization, which is the IVF method. At least that way you don't go through the fallopian tubes, because the fallopian tubes are actually where fertilization of the ovum and the sperm happens. So you can get pregnant, but not through the spontaneous routes of fertilization. And tubal ligation actually does not stop or prevent or affect sexual activity. Does not affect your menstrual cycle. The only thing for some women, it actually regularizes their cycle, or maybe shorten their days, but you still tend to menstruate. Sexual activity is still on point. There's no guilt, because it's actually something you decide on your own, and you don't even have to start thinking of taking pills or implants, other contraceptive method, because you're actually good. Then that is pretty much about what happens with tubal ligation. But there's a study that actually says that vasectomy is actually more effective than the tubal ligation, but it's not, is in quotes actually. So yes, tubal ligation is open to women, but before you make such a decision, be sure you're done. Be sure you would not have a rethink later on, and be sure you're doing it for yourself. Yes, be sure you're doing it for yourself. So that is much about our contraceptive methods, and this actually comes to the end of the contraceptive methods. So you can actually go click on my other videos, because I've made references to several other contraceptive methods, and this wraps up our series on contraceptive methods. So It's Tubal Ligation, ladies. I hope you do got value from this video. Remember to click on the subscribe button if you've not done so, and kindly subscribe to my YouTube channel. Share this video to friends and family, and let them learn one or two things. So thank you. I hope to see you in my next video. Remember to always stay healthy and create your happy place. Bye for now.